Sister Almutairi, a final year medical student from the University of London. I'll speak today about
I do not see any slides, but it does say that screen is being shared.
Do you see it now?
No. Yes.
And now?
No, yes, I can see it.
Yes. Okay, I will speak today about the impact of radiation exposure and on orthopedic surgeons in specific and other healthcare worker which has exposure to this kind of radiation. Firstly, I will begin with the X-ray machines itself. This is a kind of X-ray machine which is most usually used in the operation rooms, which is called the C-arm machine for X-ray. This kind of machine gives an ionizing radiation. This kind of radiation which is have some harmful for the patient itself and for the healthcare worker, which is in the operation room, and specifically the orthopedic surgeon, which is using this kind of machines. So to begin with, we have in this C-arm X-ray machine, we have the source of the radiation, which is come from the A point at the below, and the screen, which is give the visualization for the bones on this machine. So firstly, the ionizing radiation, which is given by this kind of machines, it's called ionizing radiation, which is, as we see, it's part of it, the X-rays, which is ionizing radiation, which is have an impact on the healthcare workers. Because of that, we have a protective equipment that have many so important as healthcare workers to protect ourselves before helping patients. So to begin with, this kind of radiations have impact on the eye, as we see, and skin. For skin, we have cancers, and some studies suggest that there are a relation between the ionizing radiation and the skin eczema specifically, and some cancers of the skins, and even the cataract for the eyes. And for pregnant lady healthcare workers, have a harmful effect on fetus itself. So factors that help to protect ourselves as healthcare worker and surgeons from this kind of radiation is the personal protective equipment. We'll spoke about it within a minute, and reduce amount of time being near this kind of radiation, and have a good distance of them from the source of radiation, which is we spoke about the A arm, which is the lower arm. We have some distance from this arm will help for reduce this kind of radiation, and have a low dose of radiation. Some studies suggest that having an experienced surgeon, orthopedic surgeon, will have a low dose of radiation, which is, as we know, low dose of radiation using an X-ray machine will have not that accurate as the high dose radiation. So experienced surgeon, which use low doses and low accurate picture, will reduce the exposure for all healthcare worker in the operation room. And now we'll begin with the personal protective equipment, as all body know, which is the lead airborne, which is for the abdomen and the groin area, and the lead thyroid, which is protect the thyroid area, and the lead gloves for protecting the skin over the hands. And we have the lead glasses, which is to protect the eye from cataract that it's affected by this radiation. So we will have discussion about the evidence-based about this kind of protections for surgeons and healthcare worker in the operation room. Firstly, the lead apron, which is, we have two kinds of lead aprons, the 0.25 millimeter lead equivalency, which is the diameter of this lid, and the other kind, which is 0.5, which is more thicker. Firstly, the low weight, which is 1 to 5 kilogram lid apron, which is 0.25 millimeter, have 75% reduce the X-ray beams, which is when we use a low dose, which is 15. And when we use the high dose, which is 100, it's decreased to 50%. But the thicker one, which is 0.5, which is a heavier, about 3 to 7 kilometer, reduce the low doses, which is 15 to 99.9%, which is a huge and good protective. And if we use the high dose, which is 100, it protects 75%. So using a low dose and having the thick lid apron will protect ourselves by 99.9%, as the evidence said. And some important thing that having the lid apron in the operation rooms, which is having this lid aprons, after using it, put it at a proper place without folding it. Studies and research shows that folding this kind of apron and lid, which is cut the fiber inside it, which is decrease the accuracy of it and decrease its protection. So don't fold this kind of apron to have more protection from it. So, and we have the lid thyroid collar, which is protect the thyroid. We have it's about 0.5 millimeter lid equivalent as a thickness. It's protect our thyroid by 2.5 times, and total exposure about 50%, which is a good protection with having a good distance from the radiation exposure. And the lid glasses, which is studies shows that not all orthopedic surgeons specific, which is use X-ray machines, not all of them having the lid glasses. And the lid glasses has a huge importance for protect eyes from having cataract with long-term exposure to this kind of radiation. Some kind of lid glasses have a 0.75 millimeter of lid, which is have a good protection for the eyes. After we finishing the personal protective equipment, which is, as we see, have a huge important to save ourselves from the high exposure for radiation, we will go for having a distance from the source. So after having a distance from the source of ionizing radiation, which is X-ray machines, we have distraction of this radiation, which is decrease its accuracy when we have, or decrease its effect when we have a huge distance from it. Some evidence said that having two steps about 30 to 40 centimeters reduce the radiation about 80%, which is very good number. And some evidence said having only 20 centimeter will decrease the radiation about 37%, which is a good reduction of this exposure. So having a distance will reduce the exposure. And time using radiation, which is number of taking picture, evidence said that having an expert surgeon will reduce the number of pictures have been taken in the operation room by 60%, which is a huge decrease in the number of pictures. So having an expert surgeon will decrease the radiation exposure for the surgeon and the healthcare worker on the operation rooms, in the operation room. So to conclude, we have something we will take, which is personal protective equipment, reduce the exposure, and having a distance, and having an expert surgeon to decrease the dose of radiation and decrease the time of radiation, which is the number of pictures we will take in the operation room. So thank you. And if there are any question and for more resource, you can text me with my email.